Hi there. This video is to help you interrogate the system and understand why the system might be requesting particular bloods or OBS. We've done a separate video about how to look at what monitoring is in place for, say, a particular medication or condition, and there's a bit of overlap. But in this video, I want to show you how to see, for example, why has a particular blood test been ordered. Now, it might be that it's specific to the patient, and so you might need to start by looking there. But if you want to see what's going on with our system, the main thing that we use a lot for this sort of stuff is status alerts. So in System 1, use the Search Features button, which is always really useful, and come to Status Alerts. Currently, all of ours are labeled with IHS at the start. And if we go to, say, Blood Test Due, you can see all the different bloods that the system might be requesting. Some of these would only ever be requested because of a clinician kind of initiating it and saying they want to have this test. Others are based on medication and other things. So the one that's come up a couple of times recently is this one, PTH. So if I click on this, and normally you won't have this box at the bottom, but if I click Show Hide Details, I can see the report that triggers it. Clicking on the blue eye then brings up this. If you are familiar with reports, then this is probably all you need to know, but I'll keep going because it's not always the most intuitive. So you've got different ways that the system can request it. So let's start actually at the bottom. You've got here in the folder monitored requested bloods, i.e. this is a person requesting the PTH, which is probably not what you're interested in. You've got here then needed every 3 months and not excluded from routine monitoring. So we have actually configured here, as you can see, that certain labs don't routinely offer PTH, and therefore our system wouldn't pick it up. If you wanted to stop having it ordered altogether, you could ask us and we could add your lab into there, or your practice if it's specific to you. And then you can see here, holding report, obviously ignore that. And these are the two reasons for 3 monthly PTH, alpha calcidol, and then also Sinusolette for secondary hyperparathyroidism. If you want to look yet further, you can keep on going, and you can see what repeats would trigger this. And similarly for this, you can see patients got to have that diagnosis and be in the report that they're on Sinusolette. I'm not even sure it's Cinacalcet, one of those, and it's not under secondary care monitoring. So that's the 3 monthly. Go all the way back to PTH annually. And again, we sort of follow the same sort of thread. So it's not been done in the last 12 months. And we've got here the two things, bariatric surgery that's monitored in primary care, and then CKD4 or 5. And again, you can see how the codes work. You can see what the exclusions are. So for example, if bariatric surgery, there's a way in the system that you can record that it's been discharged to bariatric service, and so on and so forth. If you're kind of getting bloods like this and you're thinking, why is this coming? This might help you and probably make sense of it. If on a specific patient you want to know, would still recommend just go in the recall overview. Again, there's other videos on that, and look at the reasons for monitoring, and you'll probably find it there. I'll just show you briefly one more that's come in recently. Again, gets sometimes queried. It's ECGs. So again, OBS due now instead of bloods. You'll also note there's this exclusion. So there's things like for patients got pacemaker, system accounts for that kind of stuff. This has got a lot more options, but a lot of these, like say ECG every 2 months, is only if it's been configured on a particular patient. That's what this folder monitor frequency means. Again, the one that's going to be most common is the annual. And then if we follow it through, this is all for medication, and you've got the 4 reasons there. Hope that helps. If you look at this and you then think, oh, I'm not sure that's appropriate, by all means, submit a request and we can review what guidance has driven that. And please do send us what you think the guidance we should be looking at is. But I hope that helps you to understand a bit more what the system's doing and why. Thanks.